Today's webinar is about how to improve communication with your healthcare team and make informed decisions as a lymphoma patient. We chose this topic because effective communication helps patients understand their diagnosis and treatment options more fully. Educated patients are empowered patients, and when patients like you are able to communicate well with your healthcare team, you can participate more actively in your care and make informed decisions that align with your goals and values. We are very excited to hear from Dr. Anni McKinnon today about this important topic. Dr. McKinnon is the chair of the Utah Health Literacy Coalition and the Salt Lake County Health Department Health Literacy Program Manager. She has over 20 years of experience in the health industry, all reliant on getting clear health information to the end user so they can make well-informed health decisions. Dr. McKinnon works on both sides of health literacy, organizational and personal, to improve how information is provided and received. And with that, I will turn it over to Dr. McKinnon for her presentation.
Well, thank you for having me today. Let me pull up my information to share with all of you. Okay. Well, like I said, thank you for having me today. And I'm so happy to be here to talk with you about empowering your healthcare journey. I hope that today you will be able to learn how to prepare for a medical appointment to improve communication with your provider, and that you'll feel empowered to be involved in your healthcare decisions, and that you'll learn how to use what's called the teach-back method with your provider to check for understanding of information. So we'll start by discussing how to prepare for your medical appointments. It is vital to be able to be part of your decision-making process by preparing for your medical appointments. When preparing for an appointment, you should do these 5 things, and we'll go into depth with all of these. So you should always make a list of questions, bring important health information, explain your symptoms clearly, be prepared to take notes, and you should always understand your next steps before you ever leave an appointment. And so let's dive into each of these tips and talk more about them. So before each appointment—
Sorry, Dr. McKinnon, I don't think we can see your screen.
Oh, you can't see it? All right, let's see. Can you see it now?
I cannot see it. Okay, there we go.
Can you see it now?
Yes.
All right, let's try this again. Okay. How's that?
That's perfect.
Okay, great. Okay, so before you go to any appointment, you want to make a list of any questions that you could possibly be talking about before you go in to your appointment. So thinking about what you want to get out of your appointment is the first thing that you'll want to do before you go in. What is it that you want from your care team before you go into the appointment? And each appointment is going to be a little bit different, depending on what it is. Is it going to be a treatment? Is it going to be a consultation? So think about what it is that you're going in for, and then what questions do you need to write down and make a list of those questions so that you are prepared before you go into that treatment session or into that meeting, into any appointment. So think about any of those things. So it could be like, what are my treatment options? How soon do I need to choose a treatment? What could be the side effects? You might want to ask, do I need a test to confirm my diagnosis? Where do I need to get that test? How is the test done? What does the test tell you or us? what is this medication for? If you're going to be put on a new medication or a different medication, talking that through, asking that question. What are the side effects? When should I take it? Getting all that information. How long will my recovery be? What help will I need at home? So thinking through all of these different kind of questions and writing them ahead of time so that you don't forget anything once you get to your appointment. We all know that once we get there, it can be a little overwhelming once we start getting a lot of information and the doctor starts, or the provider or the care team starts asking us questions. It can feel a little bit overwhelming. So if you write all of these ahead of time, you're prepared and you don't forget things that you know that you wanted to get out of your appointment. So writing them ahead of times is very important. So the next thing that you want to do is bring all of your important health information with you. So you should have a notebook, or put it in an app, put it in your phone, in a note section of your phone, wherever you put it, that you keep it for always. This is some information where you're going to store it and you can quickly refer to it and provide it so that you don't need to waste any time trying to recall any of this information. And you can always be accurate and consistent. And you're going to keep this information up to date as things change so that you have a historical log of information. You might forget past medications or past symptoms. So this helps you to quickly recall this information. So the things that you'll want to keep in this log are current symptoms, anything that currently you're experiencing, current symptoms or current reactions. Record those things in this notebook. Any past symptoms that you've had, and more importantly, the dates that you experienced them. Write down all the current medications that you're on so that you can refer to those and share that information with your care team. And record all of the past medications, any adverse reactions that you had to them, and of course, why you stopped taking them so that you can recall that information quickly and share that with your team. Any allergies that you have, any diagnoses that you have, all of your past procedures and surgeries, including those dates. Write down all of your results from lab work, imaging, medical tests, record all of that. Keep all the names and phone numbers and addresses of all of your care team, all of your doctors, the name, phone numbers, and relationships of your emergency contacts, and the name, phone numbers, and addresses of the pharmacy where you want anything sent. So you can refer to this information quickly. And again, you don't waste time trying to recall any of this information, and you stay consistent and remember this. The next thing that we just talked about is kind of writing down those symptoms. So clear communication with your care team is crucial, so that you can help provide, that they can help provide you the best care possible. And so clearly explaining any pain, any symptoms, any reactions to your treatment is going to be important so that they can make changes based on all of the information you can give them. And you should be documenting this so that you have a historical account. So when they ask you about pain, symptoms, reactions, think through all of these things when you give them the information. So think about, where's the location of the symptom, the reaction, the pain? Is it in one spot, or is it, starting here and moving, radiating to there? Give a specific location of where the symptom, pain, reaction is happening. Give them timing. When did it start? Because then you can also go back through this historical log and see if it correlates with this, with the treatment, with the medication. So this timing will be an important thing to record. Duration, how long did it last? Did this symptom last an hour? Did it last 2 weeks? Write that down and record that. Frequency, is this happening daily, over a certain amount of time? Write all that information down. Again, this is information that gives your care team crucial information to help you with that care. Severity on a scale of 1 to 10. 1 is typically not very severe. 10 is extremely severe. So writing that information will help you see, is it getting worse or is it getting better? And then a description will really help. Is it a stabbing pain? Is it a throbbing pain? Was the reaction like an itching? Did you get a rash? Describe those things. And again, then you can go through that documentation and find out what was happening. Any at-home treatments that you used, ibuprofen, Tylenol, Benadryl cream on it. Write those things down so that your doctor knows what you've already done, so that they make sure that they're not doing anything that is going to contradict what you've done, and they can talk to you about if, what would be next steps. And then take pictures of everything, especially with any chemo treatments or anything. You can have some bad reactions, some rashes. Take pictures of those, especially where they're at and anything else, so that you can document, is it getting worse? Is it getting better? And if you need to take a picture from day to day, document all of that so that your care team can watch that and document that and see. So this is an important thing for your care team to see. The next thing is to take notes during your appointments. So again, have a medical journal, however it is that is best for you, documenting all of your appointments. So if this is in a notebook, if this is on your phone, wherever you want to keep your information, but you want to document who you met with at each appointment. So put down the date, who did you meet with, what did you discuss, what did you do at the appointment, what decisions did you make, were there any changes in treatment, any changes in medication that are going to happen? Do you need to have tests done? And when will they be done? Why will they be done? And when will you find out results? Any of that, make sure you're writing all of that down so that you don't forget anything. Sometimes people take notes by recording it. When you go into the doctor, just, hitting record on your phone. If that's the way you want to take notes, just ask the care team, do you mind if I record this so that I can document, what it is that we were talking about today, just so that they know they're being recorded. But that's another way for you to take notes, is just to have that audio transcript of things, but just making sure that you let them know that you'd like to record that. The next thing is, before you leave any appointment, find out what you need to do next. If your next step is a test, confirm where and when that test needs to take place. If your next step is a treatment, confirm where, why, and when that treatment is. If it's a follow-up to treatment, confirm what will happen at that follow-up and where and when. So be open to asking your care team for written instructions, ask for brochures, ask for videos that will give you more information, ask for websites, ask for all the information that you need to feel clear and understand all of those next steps. So have that really clear communication with your care team so that you are feeling like you can make these clear decisions with your care team. So I just wanted to share 2 tools that are some free apps that you might find useful. So the first one is this app called Question Builder. So it's from the Agency for Healthcare Research and Quality. And what this one is, so if you just went into your app store and put AHRQ Question Builder, or you can find it by this QR code. But what this does is it helps you build questions for your appointment. So it will just guide you through, why are you going into the appointment? And then it'll prompt you with questions you might want to ask your provider. And then it just helps you list those questions. It also helps you put in all your symptoms. So all the symptoms, things that we talked about, it will help you list out all of those symptoms, the duration, the location, the timing, the severity, and helps you document all of that. And so that's what this app does. It also helps you keep track of your upcoming appointments and your providers. So again, it's free and might be helpful for you. It might not, but this is out there and it's a tool that you could use. Another tool that some people have found useful is called MediSafe. It's a free app that you can use to manage your medications. You enter the medications in that you're taking and when you need to take them, and it will remind you to take your medications when it's time to take them. It will also tell you if there's any interactions between different medications, that if there could be possible interactions. It gives you reminders when you need refills, reminders of appointments. It has the ability to track things like blood pressure, weight, A1C, cholesterol, things like that. It also has a space for a diary where you can keep notes in here. It does have a paid feature. So if that pops up, you can just click, no, thank you, and just use it, the free features on it. And so, you can decline that. So this is another place where you can just store and document things if paper's not your thing, but paper works great too. These are just a couple tools that can help you as, reminders and documenting things. So the next thing let's talk about is being proactive in your healthcare and the decision making. So not just being one who's being told here's what we're going to do for you, but being part of that decision making process all along the way. So the AHRQ agency I was just talking about, they give these 10 questions right here that you should know the answers to. So these 10 questions are things that you should be able to go home to and answer for a loved one who asks you any of these questions. So just thinking through this process, and they put these questions out there so that you become more comfortable asking questions when you go into your provider, that you should always leave an appointment feeling informed, that you learn to be inquisitive about your healthcare, and that empowers you into your decision making. Sometimes we get so overwhelmed at an appointment that we just listen to the provider or our care team. And then when we leave, we start thinking about some of these questions. And so that's why it is so imperative to prepare ahead of time and write these things down and think through these types of questions. So if your provider says you need this test, you would ask, what is the test for? When will I get the results? So that if you get home and you tell someone, I need to get this test, and they ask you, what is the test for? You can tell them exactly, the test is for this, and this is what I'm going to find out. This is why I'm getting the test, and you know all that information. If the doctor tells you you need to get a new medication, ask them, how do I spell that? So you can write it down and you can do some more research on it if you would like to. And are there side effects of this treatment, of this medication? Talk through those side effects. This is a good question that you need the answer to. Will this medication interact with medicines that I'm already taking? So you have that list of medications that you're taking. You can share that with your provider, and you can share it with a pharmacist. You have all of this, and you'll know the medications that you're on. And if you choose to look at a new one, you'll be able to look at that. And this is a really good question to ask. Again, why do I need this treatment? Are there alternatives is a great question to ask. Talking that through with your provider so that you can make the decision that's best for you. What are the possible complications? Which hospital is best for my needs? And how many times have you done this procedure? Sometimes people feel a little awkward asking that questions, but it is a totally viable question for you to ask. And if it helps put you at ease, ask that question. Doctors want you to feel comfortable asking these questions and having that conversation with them. So these are just a few questions to get you started, but think through what other questions. Why am I going to this appointment? And when I leave, what am I going to feel comfortable with so that all of my questions are answered? So when you leave and you have these questions, you're going to probably want to research a little bit more. So we live in an age where we can find, we're empowered to find out information from home. We can search it on the internet for treatments, for information, but you want to ensure that you're getting quality and reliable information. When you find a website, look through these things to make sure that it's information that you can trust. So ask yourself these questions before you ever trust a website. Ask yourself, what is the purpose of this website? Why does this website exist? Does this website exist to sell me something? So they might have an ulterior motive if they're trying to sell you something. Are they there just to educate you? Then that's probably a great site if they're just there to educate you and to empower you with more information. Who wrote the information? Find out, are they credible people who wrote the information? Are they qualified to write the information? The information should be at the bottom of the website always, so that you can find out the people who put the information on there, are they qualified to give you the information? When was the information updated? Again, the at the bottom, it should tell you if it was last updated in 2012, it's probably not the best information. Health information is constantly updating yearly, so websites should be updated yearly. Is my privacy protected? Are they going to ask for information? If you're looking through that, now everything pops up that has the cookies thing that you have to accept or reject. So are they tracking what you're doing on their website, and are you comfortable with that? Does the site ask for personal information? If you have to enter your information for them to give you information, why do you have to do that? You shouldn't have to put in your information for you to get information from them. A website where you can just go in and gather information, it should just be there for you to go in and look at. And does it offer unrealistic health solutions? If you're going in and finding information where it says it's going to cure something that no one else can, that's probably unrealistic, and you should be very cautious in trusting that health information. So Medline Plus is a great website that has very reliable information. It's written in what we call plain language for most people to understand, and it's research-based. So that's a great website. And finding just these resources that you feel like it's quality information. If it's a .gov, it's written by government. They always assess that information and make sure that any information on their websites is written by people who are qualified to put the information on there. So looking at that, you can ensure, again, who's written that, and you're not just someone's not just putting out there so they can then sell you some miracle treatment. So this says here, empower yourself by asking questions and seeking clarity during your healthcare journey. So we've just talked about empowering yourself by asking questions. And so now let's talk about seeking clarity during your healthcare decision, your journey. So check understanding. So I'm going to talk about a method that providers should be using with you. It's called the teach back method, but if they don't, you can use it with them to ensure that you understand information and there's clear information moving forward. So we're going to watch two short videos. The first one's like a minute and the second one is like a minute and 15 seconds. They're very short. So we're going to watch this first one. And this first one is what we hope that a visit looks like for you.
So Mac, you have something that we call exercise-induced asthma. That's what happens when you're doing a prolonged exercise. So to exercise for a long period of time, and then you start to feel short of breath. And that's because the muscles deep down in your lungs start to twitch. Fortunately, we have a medicine that's going to really help you with this. And I'm going to show that to you and your dad how to do it. And to make sure that I was clear, I'm going to explain it to you, and then I'm going to ask to make sure that you can explain it back to me so you know how to do it. I'm going to show both of you, but I'm going to really make sure you understand how to do it, because I assume dad might not always be with you to practice to do this. And I'm going to show you, it's going to take a few times of practice to learn how to do this, just to make sure. So What I'll do first is want to make sure you don't have any questions about that. Nope. I'm going to send two things down to the pharmacy. One is called an inhaler and one is called a spacer. So you're going to pop this lid off. You're going to stick it in the spacer and you're going to pop this off. I'm not going to put it in my mouth here because this is just for me to show you how to do it, but you're going to put it in your mouth. You want to do this about 15 minutes before you start your exercise. You're going to give yourself a puff, but before you do that, you want to take a deep breath in and then blow all the way out. And then you're going to breathe in over about 5 to 10 seconds, hold it for 5 seconds and breathe out. Then you're going to want to do that a couple of times, but you want to wait a few seconds in between, a little bit, about half a minute or so. All right. What other questions might you have? I don't have any.
So in that video, the provider explains information, not using any jargon. She just explains in plain language the information to her patient. And she shows what the spacer is, shows how to use the inhaler, and shares the information so that he can understand, and even shows. And so that's what we want in a provider, is that the provider will speak to you and share the information in a clear way of understanding. So let's look at this second video of what we hope that is not happening. So this is a provider using a lot of jargon and can cause a lot of confusion.
So Mac, you have something that we call exercise-induced asthma. That's when you get inflammation down in the lungs, causes bronchospasm, and that's why it's hard for you to breathe when you're doing exercises like swimming, gym class, that sort of thing. Luckily, we got something here that's going to fix you right up and get you back on the way. Any questions? No. So I'm going to send down to the pharmacy two things, one an inhaler, one a spacer. What you're going to do is pop off the lid here, pop it into the spacer. You're going to give yourself 2 puffs through the spacer, do it about 15 minutes before exercise, and then you should be good to go. Any questions? No. All right, well, that's great. So if you have any questions, you can give our office a call. Otherwise, we'll see you next year. What did she just say? I have no idea.
So if you're having appointments like this second appointment where you're feeling like there's a lot of jargon being used and you're just really confused, you can use what's called the teach back method with your provider. And so providers should be using this with you, but this is what the teach back method looks like. It's asking the provider for clear information so that you can teach back to them the information in your own words to ensure that you understand what they have told you. And then if you don't share back the information as they intended to tell you, they know that they did not explain it clearly and they need to re-explain it differently. So the ways that you can ask this, you can say, "This is new to me. Will you explain this to me one more time?" Or, "Here's what I heard you say. Do I have it right? I need to be able to explain this to my spouse when I get home. Can you go over that again to be sure it's clear to me?" Or, "I want to go over this again with you because it's complicated. Or can you write that down for me?" And then once they re-explain it to you, you restate the information in your own words. And then when you restate it in your own words, it's you reteaching to them what you heard them say. And then you're ensuring that you really did understand what they intended for you to hear. And then again, if you didn't restate that in a way that they intended, they know that they did not explain it in the way that they should have, and they need to restate it. So this is all about communication, and it's how the provider is communicating information to you. And they need to be as clear as possible. And so putting that on them is just, "This is new to me, please explain it to me. And now I want to share with you how I heard that. Can I make sure that I understood it correctly?" So this is a way to just really talk about that. If you learn better with visuals, ask them to use a model. So if it's something that's, going on with the heart, you would say, do you have a heart model? And you could show me with a heart what's going on here, because I need to see it. Could you give me a brochure so I can read that up a little bit more? Can you give me a website where I can go look and read more about this, because I need to understand more? So talk to your provider and ask them enough information so that you feel comfortable with the information and you feel like there's clear communication with them. So ask them these questions, and that when you're leaving, you're not leaving with that information feeling like, I have no idea what you just said to me. You're using all this medical jargon, and you can even say, can you share that to me in plain language, and don't use medical jargon. Use it and say it to me in a way that I can understand. So empowered patients ask questions boldly, and they ensure that they have clear communication with their care team. So they're not afraid to say, I didn't understand what you said. Please explain that to me in a way. I'm not a doctor, and I need that explained to me in language that I can understand. And so it doesn't say anything to the amount of education that you have or anything else. All it's sharing to them is, hey, this is new information for me, and I need you to explain it so that I can make the best decision for me. And a provider, when you say it that way, helps them understand, okay, yeah, I'm talking the way that I would to my colleagues and not to a patient who needs to make a decision. Let me restate this to them so that they can feel like they have the information. So be that empowered patient, and have that clear communication with your provider. Preparing for your health appointments is one of the most important things that you can do to be health literate and to take charge of your health. If you're prepared, you have thought through what you want out of each appointment, each time that you go in, and you'll be more prepared to make your health decisions. Be prepared, and you'll be being prepared leads to better health outcomes and informed decisions. So as a summary, preparing for medical appointments means knowing your questions and health goals of each appointment. So prepping ahead and knowing this is what I want out of each appointment. Making healthcare decisions together means collaborating with your providers by gathering reliable information so that you can ask questions and make informed decisions. And then using TeachBack will ensure that you have clear communication with your care team. And that is all the information I have. So thank you. And I will stop sharing. So if anyone has questions, you can.
Thank you so much for that wonderful presentation, Dr. McKinnon. So like she just said, it's now time for the Q&A portion of today's webinar. If you have any questions about this topic, feel free to drop them in the chat, or you can raise your hand if you want to ask your questions verbally. And it looks like we have one question at the moment. It says, it's hard for me to speak up for myself, especially when I'm overwhelmed, and sometimes I cry. Do you have any tips so that I can communicate without crying?
Yeah, absolutely. That is completely understandable, especially when you're feeling overwhelmed. They're giving you all this information. It's new. This is an emotional journey. So this is where that prepping ahead of time and even sharing with your provider, saying, hey, I'm feeling overwhelmed right now. And stating that to them, I'm feeling overwhelmed right now. Can you give me just a second to gather myself and feel however you're feeling too. Don't be ashamed to feel that. And then writing all that information down so that when you are feeling overwhelmed, you can still walk away feeling like you've got your questions answered. So being able to prepare ahead of time, you've got all that written down so that when those emotions come up and you're feeling so overwhelmed, you don't go home and say, oh, I was so overwhelmed during that appointment that I forgot to ask this and this and this. And now I'm at home and I didn't get my questions answered. And I don't know why, what treatment choice I'm going to do. And I don't know what I'm going to do next. The other thing I would suggest is bringing someone that you trust with you, because the person that you trust, if you write all the information down and talk with them ahead of time and say, here's what I want out of my appointment, and I'm probably going to get overwhelmed. Can you help me make sure that I get these things accomplished during my appointment? And then that person can really help you guide you through that information and make sure that when you're feeling overwhelmed and you're feeling like you're not getting all that information absorbed during the appointment, hopefully they're taking notes too and writing that and getting your questions answered so that when you get home later, again, you can look through that information and say, okay, I got my questions answered, and now I can absorb information and think through that a little bit more. And next time I need a few more questions answered.
Thank you for that answer. That's very helpful to, remember to prepare ahead of time, find trusted people, and be able to communicate with your doctor when you are feeling overwhelmed, but that you do have more questions to ask them. So thank you for that. And then we have another question. I feel like my doctor is always in a hurry when I go in, and I don't want to bother them by asking questions and taking up more of their time. Should I ask questions anyways, or would it be better to look up the answer at home?
You'd absolutely ask questions anyways. If your doctor's in a hurry, that's not your problem. Your doctor is there to take care of you, and you are just as important as any other patient that they're seeing. So think through that. Just think, I am here and my health, and I need to make decisions for myself. And so I need my questions answered. And these are the quizzes what I need out of my appointment today. And I'm going to get these questions answered before I leave. And so this is the time for you to think through. I am at the most important person here today for my doctor. And so I need these questions answered. Every person here is an important person, but I'm as important as any other person here. We often put ourselves, second in line if we've been caretakers our entire lives. And so this is a time for you to just say, I'm first right now, and I'm going to get this taken. I'm going to get myself taken care of. So this is not a time in your life to say, oh, I'll figure it out later. So this is crucial for you to have clear communication with your provider. So take the time, and if they act like they're in a hurry, just say, it seems like you're in a hurry. Do you want me to ask these questions or find them out when I get home? And if you are very just clear with your provider, then they'll probably slow down and say, oh, okay, yeah, maybe this is how I am. Because providers become providers because they want to treat you. So if you just specifically say that, they'll probably make sure that they answer your questions in a better way. I've done that myself when I've said, hey, it really seems like you're in a hurry. And they'll say, oh, I'm sorry, I'm here for you. What questions can I clear up for you?
Thank you. That's super helpful as well, since I know most doctors are in a rush. So I really appreciate that. And then I know you shared how to find trusted resources, and you said that Medline Plus is one website that you like to go to, but are there any other websites that you like to use for health information?
Yeah, Medline Plus is kind of my go-to because they write their stuff in plain language and clear language. They try and really simplify it. CDC is hit or miss. they write it in a simple way, but it can be kind of overwhelming when you get there because it's just broad, but they do write their stuff in a simplified way if you can navigate it once you get there. So they have some good resources. So again, they're both government agencies, and so their whole purpose of putting that information out there is to inform you. They're not trying to sell you anything or anything else. So that's why I like those resources.
Perfect. And then we have another question. Do you have any advice from the caregiver's point of view? What should I do, or what can I prepare for before or even during the doctor's appointment?
Yes, absolutely. So as a caregiver's point of view, you also have questions that you want answered because you're have some things that you might think through in a little bit of a different way. So you might be thinking through what are the treatment options. You might see some of those symptoms and reactions and stuff and documenting that stuff. So you should also be writing information down, and you should be taking notes too and helping to take those notes. That really helps the person who is the patient it takes some pressure off of them a little bit, because they don't feel like everything's on me. I've got to do all of this. I've got to come up with all the information. You're working as a team a little bit. So if you're writing notes down, and if you're preparing questions and you think through this together, you can kind of come at this together, and then together you can think through, I thought about asking this question, what do you think? Or when you're there, again, you get to kind of absorb that information also. And so you can think through that and process that and help with that decision making for the patient. And so that's what I would say is it's just as important for you to take some notes and think through that, because yeah, a patient is really having that emotional stuff that they're going through. So like I said, I'm a health literacy expert, and health literacy is how you access, understand, and use information. And someone can have a really, really high literacy, but as soon as you get told some information that is scary, your literacy and ability to process information can drop significantly, just because that's the way your brain processes things. So as a caretaker, you're able to start processing things and write down that information so you can share it later with the person who's trying to process stuff. So that would be my advice.
Thank you for that advice. That's really helpful as well. Like you said, it can be very overwhelming when you get a lymphoma or other difficult diagnosis. So yeah, having a caregiver, someone you can trust, help and write things down as well so you don't forget anything is really good advice. And I don't see any other questions at the moment. So thank you so much for, again, that wonderful presentation and for your insightful answers during this Q&A, Dr. McKinnon. And then before we go, I have a few exciting things that I would like to share with you all. One of the most powerful things about our community is how we come together to make real change happen. Right now, we have an incredible opportunity to advance blood cancer research. We're working to power 100 research projects that will change lives. If you feel called to participate, you can contribute in two meaningful ways. First, by sharing your medical journey by joining the HealthTree Cure Hub registry, because your experience matters and can help researchers understand patterns they might never see otherwise. And second, if you're able, through a donation and sharing this fundraiser with your friends and family. All donations will go directly to research. In our follow-up email, you will receive the links to join the HealthTree Cure Hub and to donate. Thank you all for being an integral part of our community, and it is our goal to make meaningful change in your lives through this initiative. I also wanted to quickly highlight how to connect your records in HealthTree Cure Hub. So after creating a HealthTree Cure Hub account, you are able to electronically connect your health records from any facility into your profile. Once your records are connected, you can view a comprehensive overview of your medical history, including diagnoses, genetics, lab results, and treatments, all within a single user-friendly interface. It only takes a few seconds to create the connection and start taking control of your diagnosis. On the screen, I have the link to sign up for HealthTree Cure Hub, along with the email address for our amazing patient navigators who are available to help you create an account and connect your records. I will also include information about how to enroll in HealthTree Cure Hub in our follow-up email, so look out for that there. As you leave the session today, we would appreciate you taking 2 to 3 minutes to fill out a brief survey about your experience during today's event. And here listed, we have a few of our upcoming events. So on Tuesday, December 3rd, we are holding a bi-monthly blood cancer financial Q&A. And on Wednesday, December 4th, we are holding a webinar with Dr. Lorenzo Fauci about bispecific antibodies for diffuse large B-cell lymphoma. We have many more virtual and in-person events in the works, so stay tuned. And the link to sign up for any of those events and many others is found at the bottom of the slide and will also be sent out in the follow-up email. Once again, I would like to thank our sponsors, Regeneron and Bristol Myers Squibb. And finally, I just want to say thank you again to Dr. McKinnon for the wonderful presentation, and a huge thank you to you all for helping us build our DLBCL and follicular lymphoma community. I've added my email to this slide, so please don't hesitate to reach out if you have any questions about HealthTree or any of our programs. I appreciate you all, and I hope you have a great rest of your day, and I hope to see you all at another webinar soon.